right, welcome to Screen Time with today's communique. We are so delighted to have Dr. Marian Evans with the UAPB MISRGO program to talk about all things tobacco control and the Arkansas Cancer Summit that is coming up in March. But before we begin, I want to say welcome to Dr. Evans.
Hello. Hello. How are you?
All is well. Thank you for joining us today. Before we talk about MISRGO and the Arkansas Cancer Summit, tell us a little bit about you and your career path.
Okay. Well, I attended the University of Central Arkansas, where I obtained my Bachelor of Science in Health Sciences. And then I attended Tulane University in New Orleans, Louisiana, and I obtained a Master of Public Health degree, focusing just in general health education, health sciences. And then I obtained my Doctorate of Public Health and Public Health Leadership at the University of Arkansas for Medical Sciences at the Faye W. Bozeman College of Public Health.
And so, Dr. Evans, tell us a little bit about how you came to begin working for the UAPB MISRGO program.
Okay. I spent some time with the Arkansas Department of Health, and I was the tobacco health educator then when I started my career early on. And so later on in my career, I applied to become the coordinator for the Minority Initiative Sub-recipient Grant Office at the University of Arkansas at Pine Bluff. And there we have 3 programs that are funded by the Master Tobacco Settlement dollars. And it's our program, the Minority Initiative Sub-recipient Grant Office, the Master of Science degree in Addiction Studies, in the Minority Research Center on Tobacco and Addictions. And so the Minority Sub-Grant Office, we provide oversight to a portion of those funds that come to the University of Arkansas at Pine Bluff. And what we do is we provide grant funding and program oversight to community-based organizations focusing their efforts in communities of color for tobacco prevention and education.
And I'm so glad you mentioned that because that gives me a segue into talking about the Cancer Summit and you all's partnership with the Arkansas Cancer Coalition in hosting the 2-day summit. And
Okay.
so tell us just a little bit about the summit and what folks can expect.
Okay. Well, we began our partnership about 3 years ago. And so we have 2 days. The first day is the Arkansas Cancer Summit. And then the second day is the Clearing the Air in Communities of Color Conference. And so this will be our 20th year to host that conference. And so Tuesday with the Arkansas Cancer Summit is March 7th, Tuesday, March 7th. And so what people can expect is just we always combine our themes. And of course, the Arkansas Cancer Coalition will focus on cancer prevention, cancer control, and then we focus on tobacco prevention and tobacco control. And so this year we have a great lineup of speakers. And so the speakers for the Cancer Summit range from what to do post-pandemic in cancer control to nutrition, mental health for cancer survivors, mental health for caregivers, those things like that, because we want to focus on the whole person. And so that's sort of what we're doing with the tobacco control. We're focusing more so on menthol and vaping. We pulled out those 2 things because they are what's prevalent in minority communities and in the tobacco prevention world now.
And I'm glad that you mentioned what you guys are focusing on, menthol and vaping. I know a lot of people, when they think of menthol, they think of like the cigarette commercials with the guy holding his cigarette, and it's really cool to be smoking the menthol 100s. But can you talk a little bit about how the media has had, I guess, a negative impact on cigarettes and how it affects communities of color, particularly the African American community, as it relates to menthol specifically?
Okay. Well, the tobacco industry spends billions, that's billions with the B, of dollars in advertising. And so they do what we call targeted marketing. And so they target and market specific brands, specific kinds of cigarettes to different communities. And so what's marketed and branded in the minority communities are and menthol is a flavoring. And so what you see in the movies, what you see in ads is the tobacco industry paying for those kinds of placements so that those things that, matter to minorities, they'll see that, they'll see menthol brands. And so it's kind of a thing. They have all kinds of people working for them, including psychologists, telling them, if you place this here, then they're more likely to smoke this type of brand, those kinds of things. And so yeah, it plays a very negative role in our communities and what we see. And it's very specific, it's very targeted.
And to the point where I think that a lot of communities of color don't understand or don't realize that menthol is placed in the cigarettes. And correct me if I'm wrong, Dr. Evans, menthol is placed in the cigarettes as a flavoring to kind of help numb the taste buds so that those who are smoking the cigarettes, they get a larger draw of the nicotine. And
That's absolutely correct.
more of the nicotine, and it's more addictive because your taste buds are numbed in a way, and you're tasting the menthol and not necessarily the nicotine, and so you want more of that flavor and it becomes more addictive. I think I explained that in a nutshell. You can correct me.
Yes, that's absolutely correct. And it's sort of the same way I would tell students, and I said, think about a cough drop or mouthwash. And once you have the mouthwash in, your mouth kind of gets desensitized to that, that very first sting. And that's because of the menthol that's in it. And in the same way with, cough drop, if it has menthol in it, it's kind of strong. And you just kind of say, well, it's going to make my throat feel better because I'm not going to feel that burn from my sore throat. So that's exactly right. You become desensitized. You take longer drags on the cigarettes. You become more addicted because you're getting addicted to the nicotine, but you don't taste it. You taste the menthol. You get the menthol flavoring.
And of course, we know that the same with vaping. A lot of times with vaping, how they put the flavors in the vaping so that kids particularly are not tasting the nicotine. It's the flavoring in the vaping, and we know that it causes so many. Is it mouth cancers and um, cancers of the throat and things like that? But they're not. Kids are not thinking about that at the time. They're just thinking about the flavor and the hit that they're going to get from the vaping.
Absolutely. They just think it's just water vapor. A lot of them think it's just water vapor, and they're tasting the bubble gum or the grape or whatever is in it. But you're absolutely correct as far as the health effects that come from vaping. And so last year at our conference, we had the opportunity to bring in Daniel Ament. And Daniel, he wouldn't even buy the vaping products. He would just do something with his friends, use it. And so before his senior year of high school, he had to miss his whole entire senior year of high school because he got sick. He got sick from vaping, and he had to have a double lung transplant, the first in the country to have both lungs replaced. And so he's now, telling the world about vaping through his programs. And so we worked with him extensively, but he's going to do some more work for us as we go into the schools to talk about how bad vaping really is.
And I love that, to have someone who's experienced the effects, the negative effects of vaping and what it does on the body, to come and say, hey, you don't want to do this. This is what happened to me.
Mm-hmm.
Guys are using people who've been actually affected by cigarettes, by menthol, by vaping, to come and share with others with the hope that they too won't go down that path. Um,
Mm-hmm.
and so when we think about back to menthol,
Mm-hmm.
I'm bouncing around here, but
That's
back
okay.
to when we think about how it impacts communities of color, particularly Black men, as it relates
Mm-hmm.
to smoking menthol cigarettes. Can you talk a little bit about how you talked about a little bit about the advertising and how it's directed towards communities of color, but talk a little bit about how menthol flavored cigarettes has impacted the health and well-being of Black men in our community.
Okay, absolutely. It's the same health effects for everybody, but Black men, they are targeted more. We see that there are different factors as and the reasons why they smoke. And so a lot of things we can't do from our prevention side as far as tobacco is concerned, because it may be some kind of socioeconomic or demographics or environment types of issues and the reasons why they smoke. But, we try to at least try to address all of those things in some kind of way. Well, why do you smoke? Do you smoke first thing in the morning? Those kinds of things. But the health effects are detrimental. And so there are approximately about 45,000 African Americans that die each year from menthol-related illnesses, related tobacco illnesses. And so with African American men, lung cancer rates are higher. If it's from smoking, and it's a lot of factors that go into that. Don't go to the doctor. Because of the brand, you desensitize, you might, don't think that it's something is wrong, things like that. So, and just about with all of the health diseases and things that come from smoking tobacco products, it's more for African Americans, it's more for Black men.
To target back on the summit,
Mm-hmm.
can anyone join and participate, register to attend the summit, or is it just for scientific professionals, healthcare professionals? Who is it for?
It's for everyone, healthcare professionals, community advocates, just people just wanting to know more about cancer prevention, people wanting to know more about tobacco prevention. And all you have to do is go to the Arkansas Cancer Coalition website and click on Cancer Summit and register. It's free, and it's going to be virtual this year, again this year. And so, and you'll get 2 days worth of information, 2 days from the Arkansas Cancer Coalition and from the Minority Initiative Sub-recipient Grant Office.
So that's March 7th and 8th.
March 7th and 8th, yes.
I know that you mentioned a little while ago that you all are celebrating your 20th year. And so talk a little bit about, I know in 20 years you guys have done a lot, but
Yes.
talk a little bit about maybe 1 or 2 highlights that have been most impactful for you as you've been with the MISRGO program.
Okay. Well, I think the most impactful was there are 2 things. One was of course, the Clean Indoor Act, where no more smoking in public places, and also the added effect of not being able to smoke in the car with a child under the age of 5 years old. And so I think that was a huge success. And then we also had one of our sub-grantees to have that printed in the driver's license when you're studying to take your driver's test, have that law put in there, and to make people that are, the new ones starting out to drive aware that is a law, that you can't smoke in a car with a child under the age of 5.
Those 2 are very huge, and I'm glad that you mentioned those because they are wide ranging and they reach everybody.
Mm-hmm.
Literally everybody. And so when you think about what you guys have done in the past 20 years, what are you looking forward to for the future of the UAPB MISRGO program? What do you guys have in the works?
Well, I think in the future, I'll say policy-wise, we want to close the gaps. Everybody deserves to work in a smoke-free workplace. And so those places that still allow smoking because of the age restriction, we really want to close those gaps, because I don't come into your office and sit in your face and smoke a cigarette. So we shouldn't go into somebody else's place of where they work and sit in their face and smoke a cigarette or smoke tobacco products. So I think that's huge. We want to make sure we close those gaps. The other thing is bringing more awareness to vaping and helping our schools. We're working on a project with Daniel and with some more community members to bring him to the schools virtually to talk to the kids about the vaping and to help the schools with their policies as far as what happens when a student is caught vaping. What else can we do? Alternatives to suspension. And so that's what I think is on the horizon for us.
You guys are very, very busy. And you all are to be commended for even working in the tobacco space. Because a lot of times people think that it's just maybe a lost cause. Actually be working in that space. So kudos to you and your team and your staff for doing the great work that you all are doing. And we just want to remind people again that the conference is March 7th and 8th. It is virtual. It is free and it is open to anyone who wants to attend. You don't have to be a healthcare professional or a scientist to attend the conference. All you have to do is navigate over to the Arkansas Cancer Coalition website and click on the link to register. So,
Yes.
Dr. Evans, any parting thoughts, anything that you want the public just to know about the UAPB MISRGO program?
Okay. Well, with the conference has been going on for 20 years, but our program has been in existence for a little bit longer than that. And we are appreciative to those that make it possible for us to receive 15% of those set aside funds to fund our program with the subgrantees, the research program, and the Master's of Science degree in Addiction Studies.
Perfect. If someone wants to learn about the UAPB MISRGO program, how can they find out?
Okay, just give us a call at 870-575-8923. Our website is currently down, is in the works, but just call us and we'll give you all the information. Or you can email us at misrgo@uapb.edu.
All righty, Dr. Evans, thank you so much for joining us again to talk
Thank you.
about the program and the Cancer Summit. We really appreciate it. And that's a wrap.
All right, thank you. Thank you so much.